I'll probably just like to welcome everybody to this session this morning. My name is Mmboneni Muofhe. I'm the Deputy Director General for Technology Innovation at the Department of Science and Innovation. I'm going to be facilitating this session, which is a very important session, both in terms of relevance, but in terms also of how it is going to be contributing to taking us forward as a country and as a continent. This is really the focus on the harnessing of private sector in the context of the Continental Free Trade Agreement. So this is quite an interesting area because I think we have been thrown into an area through the COVID-19 where a lot of the things had to be fixed, as they typically say, as the plane is moving. And the one thing that had actually come into realization during this period is the whole concept of the African Continental Free Trade Agreement. And obviously that will have a lot of impact as we look, for example, into how we get into manufacturing of vaccines and all sorts of other biological products that deals with health in the continent. And now I've got a very powerful panel with me, and I'm going to do a very brief introduction. And from there, we're going to go according to the program in terms of who speaks first. So in this moment, let me welcome in the panel Dr. Janet Bayaruhanga. She is an appointee of NEPAD as a Senior Program Officer for Public Health. And in terms of her role, she will tell us more, especially around the health strategy and the pharmaceutical manufacturing plan for Africa, which is actually one of the areas that are going to be of critical importance in this discussion. Secondly, we've got Dr. Morena Makwana, who is the Chief Executive Officer of the BioVac Institute of South Africa. A lot of us will probably by now have heard so much about BioVac in terms of its role. And this is really, from the South African point of view, the primary focus organization in South Africa for vaccine manufacturing. And he's going to be telling us more about that. And then we've got Dr. Lawrence Banks. Dr. Banks is the Director General of the ICGB. And I think I've worked with the ICGB for a number of years now, and I can say that I haven't really met a Director General who is so committed beyond just the lip service in terms of trying to build capabilities, especially in the developing world. And Dr. Banks, we are quite pleased to have you here. You're going to be sharing with us some of the things that you're doing in the ICGB, especially those programs that are geared at building capabilities in Africa, because that has really been one area where your commitment has been very, very visible. We then also have Dr. Matthew Downham. Matthew, you've got so much experience in the global biopharmaceutical industry. And I think here there is a lot of lessons for us to learn. You can see that in Africa, we want to start going, and the momentum is right. I think in terms of timing, there can't really be a better timing than it is now in terms for us to just get going and really bring Africa into the center of the manufacturing of vaccines and other health products. We are still expected to be joined by Mr. Kalius Tutalife, who is an economist based in the SADC region. And he obviously will be looking at a whole range of programs and initiatives in SADC. But most importantly, I think one of the things we forget to think about sometimes is the economics of what we're trying to do in the whole approach around the vaccine manufacturing and also how that impacts the thinking around the Africa Continental Free Trade Agreement. Now, as we go into our program, we are going to start with Dr. Janet Bairuhanga, just in terms of the African Continental Free Trade Agreement and the facilitation of all the necessary value chains. Because one of the things that we need to realize is that Africa, in its 54 states, if you look at the states individually, we are quite a small market for whatever we are trying to do. Hence, the whole concept of free trade is quite crucial. And I just want you to really share with us how you see this actually contributing or facilitating the work that we're trying to do around the value chains for manufacturing of vaccines and productions in the continent, and also the role that Africa's pharmaceutical manufacturing plan has to play in that particular aspect. So I'm going to hand over to you, if you can just share with us your views, and then we take it from there. You're on the floor, Dr. Janet.
Thank you so much, Mr. Mmboneni. I hope you can hear me, Mr. Mmboneni. Can you hear me?
We can hear you very clearly.
Thank you so much. So I'll just go straight into my presentation. Unfortunately, it's not a PowerPoint, but just to say that on the 1st of January, officially trading within the African Continental Free Trade Area on preferences that were agreed on over a period of like 5 years started. And the ACFTA ranks second amongst the fastest instruments to be ratified at the African Union, next after the Constitutive Act that establishes the African Union. So you can see how much interested the African member states were in ratifying this instrument. It envisions an integrated African market with the potential of benefiting all 1.2 billion people on this continent. It is estimated that the trading under the ACFTA, intra-African trade, will double its 2021 levels by 2025 and lift over 100 million Africans out of poverty by 2035. Both the big businesses and SMEs will enjoy the benefits, particularly women and young Africans in trade will also be given priority under the CFTA. The country is currently at various levels of establishing the requisite administrative infrastructure, such as enforcing the customs procedures that would actually, that are required to give commercial effect to the ACFTA agreement. And I'm glad to announce that South Africa has been ranked among those countries, the few countries that have successfully put in place these customs procedures, and congratulations to South Africa. With the ACFTA, 97% of products will be at zero duty. Transit across the continent of these products will also be less hampered because the current non-tariff and tariff barriers will be reduced or removed completely for some. Trade and services is the focus, particularly in financial services, telecoms, and others, which will be boosting economic activities across various sectors. And strengthening the customs authorities' capacity to enforce the rules of origin are currently what the ACFTA is focusing on, to ensure that there's prevention of transshipping of goods, and also ensure that the ACFTA actually creates jobs rather than export the jobs. The continent is estimating over $100 billion US infrastructure finance deficit, which definitely without the necessary infrastructure like transport via railroad, air, ship, and so on, and the logistics and ICTs required to connect countries, the desired doubling of the current intra-African trade will remain a simple dream. And so the ACFTA Secretariat, as I'm aware, continues to engage various DFIs and the development finance institutions, private equity investors to inject capital into infrastructure projects across the continent, which we do hope definitely will go a long way in also facilitating trade in medical products that we're talking about today. Some countries are already investing actually in building certain infrastructure that connects countries to countries, and this is what we welcome member states to continue doing. Moreover, with the advent of the COVID-19, the issue of digitalization of our infrastructure has been brought to the forefront. Investments in the creation of digital platforms to enhance access to markets and will remain critical in making it possible for Africa to remain engaged with our regional and global supply chains while enhancing access to markets. Digitalization will go a long way in revolutionizing trade in Africa, making it affordable, accessible, and more efficient. The digital platforms intend to connect SMEs across the continent that will be providing the critical information such as that the digital platforms will be providing critical information such as due diligence, market profiles of different structures across the continent, so that SMEs are aware of what is happening where and be able to participate in these trade activities. And currently, the ACFTA is engaging in a collaborative effort with the private sector to create a trade financing facility which will be connected to these digital platforms. And currently, again, the ACFTA Secretariat, in collaboration with the Afrexim Bank, have created the Pan-African Payment and Settlement Platform that has been established to facilitate trade under the ACFTA, particularly addressing the issue of the cost of Forex, which results from the multi-currency situation on the continent. You know, we have 42 currencies across this continent, which makes sometimes difficult trade to happen. So coming to the issue of pharmaceutical manufacturing plan for Africa, since 2005, the AU's leadership adopted the Pharmaceutical Plan for Africa, commonly known as the PMPA. The main objective of this PMPA is twofold. On the one hand, it's to contribute to improving public health by making much needed medical products and health commodities of good quality available, affordable, and accessible to all. On the other hand, it is deliberate about contributing to economic development through creation of a viable pharmaceutical industry, which is competitive, can maintain a sustainable supply of products, and can be self-reliant and not dependent on imports. The PMPA identifies and implements projects and initiatives to address key challenges across the manufacturing value chain, particularly research and development, manufacture, sales, and marketing and distribution. And the areas where most of the initiatives focus are in relation to capacity and skills, to addressing capacity and skills shortages, substandard and falsified medical products, facilities that are not GMP compliant, weak and inadequate fragmented regulatory systems, lack of technology or poor technology, limited access to markets, lack of market data, lack of partnerships and linkages, and other challenges that are related, particularly cross-cutting and related to issues of conflicting policies, incoherent regulatory system across trade, health, and industry, rigid IPR laws and regimes, absence of a collective farmer vision for all stakeholders involved, and then the manner in which governments support or fund pharmaceutical sector projects. There's also tending to be a mismatch between industry needs and the education that is provided across many countries. So we're urging governments and regional economic communities, especially those that have already adopted their own regional pharmaceutical or national pharmaceutical strategies, to continue to develop and implement carefully thought through packages of incentives that will foster growth of the industry. These can be particularly through creating procurement and supply chain management ecosystems that incentivize the local industry, and then support the reduction and removal of non-tariff and tariff barriers on inputs, make access to capital affordable and long-term, invest in building robust R&D and innovation ecosystems, and adopt and implement harmonized regulatory ethics and IP systems that favor the African players. AUDA NEPAD's approach to local pharmaceutical production and African-wide vaccine manufacturing leverages on our core mandate to coordinate and execute priority regional and continental projects, strengthen the capacity of African Union member states and regional bodies, advance knowledge-based advisory support, and to serve as the continent's technical interface with all Africa's development stakeholders and development partners. We leverage the research that people, that institutions such as your own conduct, and over the years, we situate that and regionally cite and indicate what companies are more poised to commence local production of specific medical products and or vaccines. Secondly, we leverage on the good work that the regional economic communities are doing in ensuring that the right companies in the right region are enabled to manufacture, access, and utilize regional or continental platforms specifically for procurement and supply chain management, and to receive the relevant training on-site and online. Thirdly, we leverage on existing initiatives like the African Medicines Regulatory Harmonization and the African Medicines Agency, the Africa Pharma Conference, and Homegrown Solutions Business Accelerator, all aimed at building resilient health systems. We are currently mobilizing partners to support the implementation of a package of Africa Pharma initiatives expected to support 100 pharmaceutical companies across the continent. And through these initiatives, we over the next 3 years, we envisage to establish and operationalize the Africa Pharma Partners Platform Secretariat to support the conduct of in-depth assessments and gap analysis of 100 pharma companies and coordinate the implementation of these initiatives. We envisage also to develop and implement the Africa Pharma Best Practices Framework, which will help us to share best-in-class policies, practices for advancing local pharmaceutical production. We also envisage to develop and implement the Africa Pharma Learning Management System that will provide make accessible, quality, cost-effective training designed to increase individual and organizational productivity and enrichment. Then fourthly, we would like to design and implement the Africa Pharma Resource Database that will support an effective and dynamic regional research network. And finally, support the operationalization of the Fund for African Pharma Development, which will complement our other current plans to set up and operationalize this fund via the African Development Bank and other institutions within the AU system. These initiatives will ultimately strengthen the continent's ability to produce. This is my final statement, my final paragraph. So these initiatives will definitely improve the fragmented regulatory system, and particularly for our vaccines manufacture coordination role. It will ensure a central body approves vaccines, logistics companies are chosen regionally and centrally, and a database is kept of those that have been vaccinated. We do welcome further conversations on these initiatives, especially with the partners around this convention that are attending and are interested in supporting Africa's pharmaceutical sector development. Thank you, and sorry for taking a little bit more time.
Okay, thanks very much. I think when we come back later to you, I just want you to think about what is, we are a very young continent. I think there's a number of youth, and the youth are yearning for opportunities. And I just really want you to probably, when we come back, to say to us, what is there for our young people as this continent, because they need to take us into the future, and we need to really find ways of making sure that whatever policies and instruments we implement they actually accommodate them. I just want to check with our technical guys because I'm getting some indication that the sound might not be what it is supposed to be. Can you just check with us, is it Lloyd, if the sound is going out as it's supposed to?
Everything's 100% now.
It's 100%. Okay, so we're going to move to Dr. Morena Mapana, and you've had, in terms of just building from the previous one, one of the things we always talk about in various forums, for example, BioVac, is the fact that we cannot have one country as a market of what we're trying to do as a continent. We need to really look at ourselves as the continent, but also thinking beyond the continent. And one of the things that we are going to need to do to achieve this thing is to appreciate the whole triple or even the quadruple helix approach in dealing with the challenges. And I just want you to really share with us your views and how you see this African Trade Agreement really contributing to some of our goals, and how the partnership between industry, academia, government, and even civil society can actually help contribute to that. And then if there are any suggestions in terms of what mechanisms can be put in place to address some of the gaps that you see, whether it's around the standards and the quality, for us to become the manufacturers that we want to be in the African continent, whether it is in South Africa, whether it is in Senegal, whether it is in Rwanda, Kenya, wherever. What is it that we need to look forward to? And I know if you've got other things that you want to share with us beyond the questions that I've raised, I hand over to you. Thank you.
Thank you to Mmboneni, and thank you to the organizers for inviting me. It's a great pleasure to participate on a topic like this. I would never have dreamt that things like, trade agreements and free trade, that vaccines would be put into the same sentence as that. Normally those things, certainly from my vantage point, were aspects that were spoken about when people were talking about, foods and, other commodities being traded around countries. And so I'm very happy that the likes of vaccines or even pharmaceuticals broadly, are being given some airtime as far as this particular topic is concerned. I think I'm going to just spend a few minutes, and I'll just have 3 slides just to contextualize some of the aspects that I wanted to talk through. But I think the first thing that I'd like to emphasize just around this theme, because the theme on this session is really about harnessing private sector in the context of Continental Free Trade Agreement. And again, I'm speaking from a vaccine manufacturer, so the context from which I come is really mainly around vaccines. And vaccines have become quite topical, as we know, largely due to the pandemic that we are still in. And, for some of us that have always been converted, we really know and believe that vaccines will actually get us out of the pandemic. Having said that, I think, the private sector involvement is quite key. And I think that's the first message that I'd like to share. I think we do need participation of government. We do need support of government. We do need government funding. But I think when it comes to industries, the best sector that can really drive industries in an agile manner is the private sector. When you look, and I'll exclude the developed world for now, and I'll just, let us just focus on emerging markets or the developing world. Most vaccine manufacturers that are successful have been those that are private sector led, but they have always worked with governments, with supranational organizations like the WHO, UNICEF, and others. So I think private sector's involvement for me, I think, is key if we are to seek more innovation, and if we're going to make sure that entities that are at high costs to run and maintain, like vaccine manufacturing and biologicals manufacture, that those facilities get run in a very modern, agile manner. That, I think time and time has proven that the private sector is best to lead that. The organization that I represent, being BioVac, is quite unique in that way, in that it has both government and private shareholding, the majority of which is private, but it does not mean, so my earlier statement does not mean that private sector sits on one side and public sector or government sits on the other side. We can find innovative ways of living in harmony in a manner that it ticks both the private and the public sector side. That's certainly our experience in South Africa. And I think as people try and build vaccine manufacturing capacity, I think it's quite important that we keep the principles of private sector of being agile, quick decision-making, less bureaucracy. But obviously we know that the commodities which we are manufacturing are public health, first and foremost, the public health. And so we do need to work with governments. So I think that's my first message, just in terms of private sector involvement, in terms of the theme of this topic. Secondly, and I'll just share my screen very quickly. And as I say that, I won't dwell too much on some of the aspects that I want to emphasize here. But I think when it comes to vaccine manufacture, I just want to remind the audience that prior to COVID, this is particularly on the continent, this is the supplies that most of Africa used to receive. So what you're seeing on the right hand of your slide is what is termed GAVI countries. And essentially, those are countries that are donor dependent in terms of supply of routine vaccines. So this is not COVID, this is not pandemic, this is routine vaccines. This is vaccines that children get on a daily basis under the routine immunization schedule. So so the countries that are in blue, whether light shaded or dark shaded, typically even till today still get a lot of the doses through this mechanism that UNICEF and the likes of GAVI have built over many, many years. A very successful program because it has contributed to the likes of polio eradication. But I want to contrast that those countries that are shaded in blue are actually getting the vaccines from the countries that are shaded in blue on the left side of the screen. And this was obviously, before the likes of COVID came. So other continents, are a large supplier to our own continent. So this is something that, for us, I'm very passionate about. Even when we talk about COVID, there will be life beyond COVID. And what is that life going to look like? Routine vaccines are still important. That's what keeps factories going. That's what reduces the risk of supply. And so it's important that, not only should we look at pandemic issues, but that we're continuously looking at what will life look like going forward. So this was, well, maybe I should say, this is still the dynamics at play when it comes to routine vaccines. Now, with COVID, it has given us a bit of a catalyst as a continent, and the African Union with the Africa CDC, have played a big part in trying to close this gap, starting with pandemic-related vaccines against COVID. And on the 12th of April this year, the Africa CDC, together with the African Union, made a commitment that by 2040, the aim is to try and make sure that 60% of vaccines that the continent needs are actually manufactured on the continent. So it's a bold statement, but it was not only a statement. We are seeing some of that, initiative and momentum picking up from the African Union and also the Africa CDC leading a lot of this. So this is the dynamic now, which essentially, coming back to this topic, really, which means that this topic is quite important about the movement of goods on the continent and the ease of which, because if we are to realize this vision of making sure that the 60% of vaccines get manufactured on the continent, this topic is quite important, and so, and again, understanding that whilst there are a few vaccine manufacturers, what the goal is that there's going to be a few hubs that are being set up on all parts of the continent, on the east and the west and the south, central, and all of this. And these initiatives are already, so this is not only hearsay, that is already starting. So essentially what it means is that as these dreams get realized, how are we going to make sure that, particularly for vaccines which are quite, they require special handling. You know, how do we transport them in a manner that makes sense, then make sure that it gets to the recipient in time? To some extent, it's even easier to transport vaccines from Europe into the continent than within the continent. And I'll end off by making, you know, just a small case study that we've experienced this year about the movement of vaccines on the continent. So I think, you know, I just wanted to paint this picture that this topic is very relevant for what's coming down the line as far as vaccine manufacturing is concerned, even though there may be limited vaccine manufacturing happening and limited trade within the continent. So I just wanted to use those slides, but maybe let me end off by talking about, you know, what needs to go in harmony, you know, with the topic that we're talking about being, you know, the free movement of goods. There are initiatives, particularly on pharmaceuticals, which are highly regulated. Okay, and I think when we talk about regulation, there's obviously regulation that deals with importation and how movement of goods go. But, you know, the context that I'm putting is really regulatory authorities. There is already mechanisms that are being put in place to make sure that there's a regulatory harmonization, which is key, because if we have to transport, you know, or we have to make sure that, you know, our Kenyan counterparts recognize what is manufactured in South Africa, that the Nigerian counterparts recognize what is produced in Kenya, and so forth. We need to strive to make sure that there's regulatory harmonization. And for me, it's certainly one of the parts that need to be there. And obviously, then anything else that makes sure that there's free movement of goods then is there to make sure that the importation and the exportation of goods runs to be free. So my last point, as I said, that I'll just make it on, you know, on a small case study, and then that's where I'll pause Mmboneni. I think it's well known in South Africa that the first vaccine that our government purchased, you know, as far as COVID vaccines are concerned, is the AstraZeneca vaccine that was produced in India by the Serum Institute of India. And that vaccine we received in January. And I think it's well known that that vaccine ended up not being utilized in the country because of the data that came through about the beta variant, and that it may not have been suitable at the time. And so we imported the vaccine. The importation of vaccine is something that we do on a daily basis. You know, that's what BioVac does on a daily basis. And we kept the vaccine in our warehouse between 2 and 8 degrees. And government, you know, the South African government then obviously negotiated with the AU and everybody else about 20 countries that actually wanted the AstraZeneca vaccine, and struck those deals. And that was a government-led initiative. So our part was to hold the vaccines, obviously, you know, under the correct conditions. And as soon as we got the signal to export, you know, we did that, and we worked very closely with the African Union. And I think if it wasn't for the urgency of COVID vaccines, just what we witnessed in a space of 2 weeks about issues about importation, you know, this country needs that. That country needs that. Oh, no. And our own country needs to export, you know, there's some mutual recognition. There's no recognition. What is the export documents? And I think, you know, it took about 2 weeks for us to be able to export to various countries. And I say, if it wasn't a pandemic, I'm not sure how long that would have taken. And so we have a live experience of the things that I'm hoping that with the Africa Free Trade Agreement that it will ease, so that, you know, the experience that we had does not continue, you know, going forward. But I'll pause there, Mmboneni, and then we can take up questions perhaps later on.
Well, thanks very much, Muren. I think it is quite important to really take note of those challenges. And my view is that this is going to be a very crucial aspect in enabling the Africa Continental Free Trade Agreement. And I think as we move to the next one of the things that I want you to think about is how we can ground everything that you have said on R&D, and we'll deal with that when we go towards closing. But in the meantime, I'm just going to ask Dr. Lawrence Banks what you see, especially in your role as ICGB Director General, the role that international partnerships can play to support Africa's ambition to manufacture its own medicines, and also, you know, in terms of some of the examples of what you're already doing as the ICGB. And in your view, what are some of the most obvious therapeutics that you think can actually be of immediate use and development in the African continent? So I hand over to you, Dr. Banks, and let's take it from there.
Thank you very much, Mmboneni. First of all, I'd just like again to thank the organisers for the invitation today. It's really a great pleasure to be at the BioAfrica Convention. And what I'm going to do in these next few slides is just to highlight where I think internationalisation, partnerships and collaborations can really make a big difference. So ICGB is an international organisation. We have research institutes in Trieste, New Delhi and Cape Town, and 66 member countries. And our footprint in Africa is quite large. We have 22 member states located across the continent, and we have several additional countries that are in the process of joining the organisation. And of course, all that we do is linked to the SDGs, and I think ICGB's trying to take a global approach to this particular issue. And for me, I think one of the most important parts to achieve these goals and to get the medicines and therapeutics to Africa is through collaborations and partnerships. And this is really very straightforward for us scientists. We do science in collaboration. And I think it's now very important that through collaborations with institutes and countries, we can help to really deliver on some of these goals. And what I'm going to do in the next couple of slides is just highlight some of the things that we've been doing in collaboration, which are specifically relevant for the African continent. And when the COVID-19 pandemic hit, it was very clear that access to diagnostics in lower middle income countries was really in a point of crisis. And so we developed a collaboration with New England Biolabs and the Bill and Melinda Gates Foundation to really just trial a novel diagnostic, but to do it particularly in a low resource setting. This is a diagnostic that was intended to replace PCR because there were so many supply problems linked to that technology. And we ran a trial in Nigeria, Ethiopia, Kenya and Cameroon. And we found that this diagnostic was particularly effective for COVID-19. And where we're moving now is to expand this. We obviously need regulatory authorization. We're moving to further countries in Africa where they can also try out the diagnostic technology in their own environments. And of course, ultimately, we want to be able to develop local production facilities. And I think the other thing, I think, well, at least a couple of the panelists have already mentioned, we also need to look beyond COVID-19. And ICGB, I think, is in a really great position now to use these types of networks spanning Africa to trial new diagnostics in low resource settings to really ensure that what we can provide is really going to be effective. Now, one of the issues that we've encountered for many years is that scientists from least developed countries often have great difficulties in accessing state-of-the-art fellowship training opportunities. And so again, through another partnership, in this case with the UN Tech Bank and the World Economy of Sciences, we've launched a program for collaborations for LDCs, specifically targeting fellows from those countries to take up training opportunities in the ICGB laboratories. And I think it's very important to emphasize that many of these LDCs are located within the African continent. And also linked to this, to get therapeutics, diagnostics, and so on and so forth out to the market, to the people who really need it, you need to ensure that there is efficient and sustainable biotechnology policy and regulatory networks. And so what we're also offering through this workshop, through this program, are training workshops online for scientists and regulators from LDCs. And this is something that I think is going to be extremely important in making this area move forward. Thanks to the Italian Ministry for Foreign Affairs, we also have a large program being developed in the Horn of Africa for, again, for fellowship training. And also in this particular instance, we're grant funding. So young scientists who have spent time overseas wish to return home and establish their own research laboratories. We will be providing funding to help those activities get established. I think gender equality is something that we're all acutely aware of, and I think in Africa and LDCs this is particularly acute. And so again, through the Ministry of Foreign Affairs, we have a program that has just been established where fellowships will be provided specifically for women scientists to be able to access state-of-the-art facilities in the labs in Trieste, New Delhi and Cape Town for training in a whole variety of different research and development activities. And again, obviously linked directly towards this as well, as I just mentioned, for women fellows from LDCs, it's really important that you dedicate specific programs so women scientists from these countries can gain access to adequate training and capacity building opportunities. And this is through a collaboration with the UN Office on South-South Cooperation, which is specifically targeting fellowships for women to go to laboratories in New Delhi and in Cape Town. And then finally, the groups of Dennis Ndolo in Cape Town, ICGB Cape Town, has developed this fantastic collaborative project, which has been supported by STVF, which is basically to promote the use of biopesticides for late season crops, to really help mitigate the problems of pesticide residue mitigation in the SADC countries, and therefore facilitate enhanced trade. In this session, obviously, we are interested in making sure that the technologies that are developed can actually get to the people who need it. And for that, we have the Technology Transfer Division of ICGB, and I'm not going to say much about the various products. I think, to answer Mmboneni's question, it shouldn't be my position to say to Africa what you really need, what you should be taking up. Obviously, production of insulin for diabetes is incredibly important, but we need to hear market analyses, assessment of the situation within different regions of Africa to understand fully what are the reagents, the biosimilars that we can deliver, which are going to be most effective. But just to emphasize that what ICGB can offer is a production capability that can produce these products to meet all the FDA and European pharmacopoeia standards, but at prices which are orders of magnitude cheaper than those that are currently available. And of course, the training that goes with this, we do it in person, but also in the course of the last year, the need for remote access to some of the technologies is something that we've been acutely aware of, and have so developed a video on-demand platform, which again is available for all of our partners. And I think with that, I'll stop at that point. I don't want to go on for too long, so I'll stop there. Just to mention on this last slide that we also do this in the agricultural sector. So we're working also very closely with partners in many of our member countries to develop biofertilizers, which really need work in the field with the partners in a specific geographical location to identify microbiomes that can be used to improve crop production and yield. So I'll stop there. Thank you very much, Mmboneni.
Thanks a lot, Dr. Banks. I think what is crucial is probably, and you mentioned this, is the issue of capacity building, especially looking at gender issues, women. I don't think there is a society that can be successful when it leaves behind the majority of its people. And in this case, women are by and large the majority. And if we leave them behind, as a country, we're just doomed to fail. Now, the next speaker is Dr. Donham. And, one of the things that CEPI was quite clear about in the beginning as we started to engage, maybe from April, May last year, on issues of manufacturing of vaccines, you were already clear in your mind that for us to really beat this pandemic, we need to expand the manufacturing capability beyond what it currently is and where it currently sits. And I found that to be very much visionary from your side. And I just want you to really now share with us what role do you think you can play as CEPI in support of our ambition as the African continent to manufacture locally, and maybe some of the key considerations that you think we need to really have. And I'm saying this because I think having amassed that number of experience in the biopharmaceutical sector for all those years, you probably would have picked up some of the lessons that we need to be wary of. So I hand over to you and then we take it. Thanks a lot. It's your turn, Dr. Donham.
Thank you very much indeed, Mboneni, and thank you also to the BioAfrica Convention for this opportunity to contribute today to this very important discussion, galvanizing, of course, momentum behind supporting vaccine manufacturing in the continent of Africa. In fact, as indicated, CEPI are very not only supportive, but already actively contributing to these important activities. And there's 4 core areas that CEPI are fulfilling that through. I guess primarily, and top of the list, arguably, is the MOU that was signed between the Africa Union, the Africa CDC, between CEPI and the CDC in April this year. And what that MOU does is it defines the shared objectives to collaborate, to develop vaccines, establish vaccine development, and manufacturing capacity and capability in Africa for the purpose of public health security and to ensure, of course, equitable access to vaccines for Africans and globally. There's a number of core kind of objectives underneath that MOU that are described within that MOU in terms of ensuring pandemic and outbreak preparedness, supporting investment in innovation to enable faster and easier production of vaccines in Africa, investing in capability and capacity, building of human resources, and I think as we've heard already, training and upskilling of workforce is a key component to reach that ambitious target for vaccine manufacturing, of course, in any country, in any region. Strengthening institutions that enable science, for example, in strengthening laboratories, research hubs, and we've heard already from Marina a little earlier, going in that department throughout the continent already. And then importantly, fostering partnerships that enable that sustainable expansion of vaccine manufacturing. No country or no continent even can do this alone. As we've seen through the COVID pandemic, it is so important for global collaboration. We've heard about some of this already in this session, but it's important to make sure that there is that collaborative partnership and association. So that's kind of one area that CEPI is focusing on, obviously the MOU together with the AU-CDC, but it's not the only area. So CEPI has this year conducted a survey. It largely builds on the survey from last year that CEPI undertook, where we have mapped the vaccine manufacturing landscape, the capabilities and the capacity throughout the Africa region. We've done this for other regions as well, Latin America, Middle East, Southeast Asia, Western Pacific, etc. But in terms of Africa, what we're doing there is taking that data and using it or helping PAVM, the Africa Union CDC PAVM organization, with their Africa vaccine manufacturing capacity capability road mapping, which is an exercise that is already in process. Marina mentioned it a moment ago in terms of how the Africa continent has been divided, as it were, into regions, and there's going to be hubs developed within each region to support vaccine manufacturing. So CEPI's data that we have is going to be leveraged to help support that process, help empower the decision-making and the process towards building that capability within those 5 hubs. CEPI is also a member of the COVAX Manufacturing Task Force, within which there is a workstream 3, that is focusing on establishing or expanding vaccine manufacturing capacity capability in Africa. The mRNA hub that the WHO announced recently in South Africa, and the intent of that hub to support not only transition of mRNA capability to Africa, but then spinning it out to other regions within the continent as well. So it's an important and long-term initiative, without any doubt. And then lastly, in terms of CEPI support, we are obviously very much closely working also with the WHO Local Production Unit. They hosted a World Local Production Forum back in June, at which was discussed those broader challenges, those broader requirements to establish vaccine manufacturing. So it's not just a case of building a facility. You need the infrastructure, you need regulatory support, workforce training, upskilling is a recurring theme, and one that really needs to be focused on moving forwards. So I think these are the kind of core areas that CEPI is very involved in already, actively contributing to, and look forward to contributing further moving forward as Africa continues on this important journey that it is indeed taking. In terms of that roadmap, and I'll be very brief here because I can see time's ticking. In terms of the roadmap, CEPI has also considered, well, what is the appropriate kind of requirement to establish or expand vaccine manufacturing? It needs to focus on regional solutions to establish that capacity, and we've heard from that already today. We need to leverage or establish collaborative partner networks and or associations, and also need to think about who is the champion, who's going to be the responsible person for that oversight and that leadership, and provide that local ownership. It has to be driven locally. It has to be owned locally. It has to be owned locally, not just the vaccine manufacturing facility capacity and capability build, but the collaborative partnerships, the training, the orientation, the long-term ambition to ensure sustainable manufacturing facilities are built. As we heard already from Morena, there's routine vaccinations. Well, those routine vaccinations can be leveraged to support facilities keeping the lights on, staying warm in those inter-pandemic periods. That's a key factor to think about. And as mentioned, the infrastructure, which I touched on a moment ago, from the World Local Production Unit, WHO World Local Production Forum. So there's some kind of key thoughts I hope are valuable and helpful, not just in terms of CEPI's interactions and collaborations. I'm happy to collaborate, of course, closely with the Africa continent, particularly with the AU and CDC, but also our thoughts as to what a roadmap looks like to transition forward to that important 2040 date that Morena shared with us a little earlier, and certainly one that CEPI stands behind and wishes to support as much as feasibly possible. And with that, I will close and hand back to you. Thank you very much, Mmboneni.
Yeah, so thanks very much. And I really think that I stand here being one of those who really appreciate the work that you're doing at CEPI. I think with you, not only will we be able to realize that really struggling to get out of the various medical conditions. I know everything obviously has to somehow end up with issues of money and economics. And I'm pleased that Mr. Kalishas Tudalife has joined us. If you really can just very briefly show with us which policy measures and incentives are required to expand the production of pharmaceutical products in the region. But I think most critically also to think about the financing instruments. How do we make sure that even as we want to get into this space, we find ourselves being able to sustain it and have a stamina to continue going forward? I know maybe some of the questions might be out of what you have prepared yourself to share with us, but in as much as it fits in there, just share with us. We want to take some of the exciting messages forward to share with the rest of the continent. Thanks very much. It's over to you, Mr. Tudalife.
Thank you very much, and I hope you can hear me.
Loud and clear.
Thank you. No, it's I'm very happy to have joined the discussion. Indeed, I'm not sure if I can adequately respond to some of the issues you mentioned, particularly related to financing instruments. But I think these things are really associated to the other. I think looking at the policy measures, I think we have to acknowledge so far in the region or at a regional level, we have always been guided by other pandemics, if you like. And this has to do with HIV and malaria, and I think to some extent TB perhaps, but predominantly those two. And so far, most of the focus discussions and outcome of deliberations have always focused on those two. Now, obviously, there has been some work that has been undertaken over many years. But I think what clearly is coming out, particularly as shown by the advent of COVID, is that we have not moved, if by any inch. I don't. We have been pretty slow at a regional in terms of us boosting regional manufacturing, and there are various factors for this. Obviously, we have to look at what is it that is within our control, as in policy measures that can really support regional manufacturing. And so a number of initiatives have been undertaken, but what is clearly also important to note is that any investor or manufacturer or enterprise that want to set up a facility, they have to be sure that the market is available to them, that they will be able to sell the products that they produce, and that they will be able to sell large quantities. And when they do that, these sales have to be over a period, probably a longer term. So they want to be sure of the market. And what we have been seeing so far in the region is that the market is not so much of a secure. You don't feel as a manufacturer that I'm here in SADC and I'm producing for SADC. It's done at national level, but there's nothing as in at a regional level where you have, that I'm producing and I'm producing for the SADC market. So there is that challenge. So I think we are saying then we have to look at at a policy level, how do we make sure that the producers that are located in SADC, they are able to produce for the whole SADC, and that this market is secure to them. And so it's something that has been worked in, I would say, over, and we've come up with a number of policy measures. One of those, of course, is the issue of pooled procurement that has been worked on, I think, for close to 10 years now. It's not yet really functional, but that's one that then countries could use. We know that it works. I think it has worked so far under COVID as one of the COVID support systems so far. So that's one issue that has been highlighted in the region. There's also the need for, as I've mentioned, the issue of regional preference. If you can't find, we know that countries have their own local or designation policies or local preference. But we are saying that if you are producing, yes, you might produce for national, and as a buyer, as government, you are buying from your local producers. If you run out, then surely you can't be looking at global, you should be looking at regional. So these are issues that we have looked at, and it's one of the measures that have been included in one of the protocols that was recently signed. Products. So there is the need the issue there is to ensure that there's certainty to a manufacturer that once they produce, there's a market available to them and that they can sell these goods. Otherwise, really, we've had challenges with ensuring that there is some kind of certainty. Then when it comes to perhaps just touching on the issue of finance, once you set up some of these things in place, I think the long-term contracts that these producers actually want, or something they would benefit from through perhaps the pooled procurement process. I think the issue of finances could come in, but we really can't be talking finances now when the market is not even secure, and that it's not available or not accessible to a producer, of products. So really, I think it is a necessity, the finance issue, but I think we have to sort out the issue of markets, that the markets are actually available. The challenge we have in SADC, particularly for those diseases I mentioned, sorry to go back just quickly, is that over the years, you have found that a lot of other governments in the region, or nations, member states in the region, they to a large extent, they have depended on donors in procuring some of the products that they needed. And this then displaces regional-based producers who, in most cases, are producing at a premium compared to producers elsewhere. And so this kind of donor dependency has not really allowed us to use respond to that. Perhaps, of course, the issue of financing that could assist local-based producers actually to reduce the cost of production, but there are many other factors that are involved in there. There's the issue of logistics. Of course, there's more work with regard to harmonization that has taken place. I think we have seen some positive moves in that regard, but I think the main issue is really about the regional market being available to regional producers. Thank you. I think I'll stop there.
Thanks very much. I think some very thought-provoking inputs there. We are actually a little bit over time, but I'm still going to allow each one of the panel members to just very briefly, whatever you might have missed and some of the things that you have picked up as we're going through the panels. 1 minute for you to wrap up, and I'm going to start with Dr. Janet, if you can just give us your 1 minute wrap up.
Thank you. Mine is just to thank you for having associated the African Union Development Agency in this conversation, and to look forward to continued collaboration with you and the other organizations represented on this panel, particularly those that have spoken to the African Union's vision to enhance the local capability to produce medicines on the continent. We look forward definitely to a coordinated approach to the way we handle the local production agenda on the. Thank you.
Thanks very much, Dr. Makwana.
Thanks, Mmboneni. I'm very happy that Kalicia's mentioned the aspect about predictable demand. I think that is certainly key for sustainability. And I'm sure I'm not only talking from a vaccine perspective, I'm talking from pharmaceuticals and other, commodities that are there. Unless there is predictable demand, the aspect of localization will just but remain a dream. But I think also, just to combine with what the other things that have come through, I think it's quite clear that there's not one factor, where we can just have a magic wand and then things will just happen. It's clear that we need a multiplicity of things to work in combination. We need the support of each government. We need support of the continent as far as the AE is concerned. We need regulatory harmonization. We need investments. We need stable markets. So I think it's a combination of things that we need in order for Africa to realize its dream. And that's my parting shot. Thank you very much, Mmboneni.
Thank you, Morena. Dr. Banks?
Yeah, I would just really like to thank everyone. It's been a tremendous session, and I agree with all that's been said, really. One thing I think that is very important is that when we do establish these production facilities and we do move forward in this, we don't want to be building huge companies that want to become competitors to Glaxo and so on. What we need are companies that are going to really serve Africa. And so I think we always have to keep that very much in mind, that the products that they're producing are going to be produced at a realistic price, which can really get to the people that need it. So, and I look forward to following up with a number of the panelists after this. Is some really insightful comments, and I'd like to discuss some of the aspects further after this session. So thank you.
Thanks very much, Dr. Donna.
Thank you very much indeed. As to add to the thanks already, much appreciate the opportunity to contribute to this important discussion. And I think, as I mentioned a moment ago, and we've been talking all the way through in some respects, the importance of collaboration, partnerships, associations being built under a kind of stewardship or a governance through the kind of champion, as it were, cannot be underestimated. Also, of course, is the importance of workforce training, upskilling of people through universities, through placements, through engagements, through international engagements, maybe through online courses, etc. Getting the workforce up and trained is also a key component to the local ownership, which is going to be so key to the long-term future of these activities. So once again, thanks very much indeed for the opportunity to speak today. And of course, CEPI stands by, as indicated by the MOU with the African Union CDC, to support and continue this important journey towards 2040 and reversing the imbalance of the 1%, 99% vaccine ratio that we saw a little earlier. That needs to be changed and changed by then easily. Thank you.
Thanks very much, Mr. Chalibe.
Thank you for the opportunity once again. Perhaps just to mention, of course, as SADC, we recognize that there's now an increasing need for public-private relationship to really move forward, and we are always going to be working very closely with the private sector and all the other international partners in making sure that we have indeed a region that works together in support of regional manufacturing. Thank you.
Thank you very much. And thank you. Somehow I just feel that the richness of the interactions that we have here, we would have done justice if we had more time, but we had to do whatever we needed to do with the time that we had. And so thanks very much. I think what is really crucial is that we need to be very strong in terms. We need to be very strong in terms of coordination. We need to collaborate. There needs to be partnership, capacity building. I think this is one thing that is very crucial in making sure that we do what we need to do. But I think the crucial thing, ultimately, this is really about trade. And as a result of that, we need to really look at the aspect that was raised, which is that of predictable demand.